Our next speaker is Dr. Mary Davenport. Mary is an obstetrician gynecologist in private practice, solo practice in the San Francisco area. She graduated from Smith College and Tufts University School of Medicine, completed her residency at the University of California, San Diego. She's on the board of the California Association of National Family Planning and the Breast Cancer Prevention Institute. She lectures widely on fertility, menopause, and pro-life issues. She's the current president of the American Association of Pro-Life Obstetrician Gynecologists. Recently, she has become medical director of Magnificat Maternal Health Project, assisting health care facilities in Nigeria to prevent maternal mortality. Please welcome Dr. Mary Davenport.
Thank you very much. And I just want to say I appreciate the contribution of Dr. Thomas Hilgers, because a lot of my talk is based on his work, and he's my teacher and the teacher of a lot of us. So I'm going to focus on infertility and natural technology therapies for infertility. There we go. So infertility is an incredibly prevalent problem. Something like 10% of all couples suffer from this in the United States, and it's a worldwide problem. There are currently about 90 million women in the world who have infertility problems. And we see, as couples get older, a very large percentage of them have this problem. And sometimes the problem is with the woman, sometimes the problem is with the man, maybe 25 to 30% of the time with the man, and sometimes with both. And so why is there more infertility? There is more infertility than there was in the past. The biggest reason, at least in developed countries in the US and Europe, is delayed marriage and childbearing. Women get married and reproduce at a lot later age, and so when they get into the 30s and even the early 40s, it's often quite a bit more difficult to get pregnant. The sexual revolution and sexually transmitted diseases has played a role. Hormonal contraception can be harmful, and there's some evidence that there's even permanent damage from it. Also, obesity is a huge problem in the United States, and it's directly related to some types of infertility problems, in particular polycystic ovarian syndrome. And then finally, environmental pollution has been recognized as a cause of infertility, and this is something that is getting worse with xenoestrogens, chemicals in the water and in the environment that resemble hormones and can mess up the way hormones work. So here is just an example of a desperate woman trying to get pregnant. So there's actually two main approaches to infertility. One is assisted reproductive technology, ART, that bypasses reproduction through normal intercourse with direct retrieval of the eggs. And there are other variations of this, but in vitro fertilization is the main type of this kind of technology, and it basically separates procreation from the sexual act. And then Dr. Hilgers has discussed at least the infrastructure and training of natural procreative technology, and this is facilitating fertility through normal intercourse, utilizing the fertility care charting system, and in conjunction with modern medical and surgical techniques. So what is IVF? Here's a picture of the first IVF baby, Louise Brown, who was born in 1978, acclaimed as a great achievement. IVF is a method in which egg cells are fertilized by sperm cells outside the mother's womb, in vitro, and then the resulting embryos are then transferred back into the uterus. And so let's just go through an IVF cycle. The woman actually is anesthetized or sedated. Her follicles are aspirated, usually through the vagina with a syringe. The eggs are incubated in follicular fluid, and then they're selected. This is sort of a genetic selection process where certain eggs have good high-quality characteristics, and they're selected out to be fertilized. And then the embryologist actually, usually a PhD scientist, manipulates the eggs and the sperm, puts them together. Sometimes, this is one of the predominant therapies for male fertility problems now, ICSI, intracytoplasmic sperm injection, where a hole is punched in the egg and actually a sperm is forced into the egg to fertilize it. And then there's a resulting embryo, either from just leaving the eggs and sperm together or ICSI, and then they're incubated for varying amounts of days in an incubator, and then the embryos are assessed, graded, some of them are discarded, and then some are transferred into the womb. So this technology has been around now maybe for 30 years, and we know a lot more about it than we did when it started. At first it was conceived of as something to be used for married couples that would bypass a problem such as obstructed tubes, but it's turned into kind of a hydra-headed monster. And so why do we oppose this as Catholics, apart from the fact that our teachers tell us that we're not supposed to do it? First of all, there's a huge loss of human life through these processes. It doesn't work. There's a very high failure rate. There's lots of twins and triplets, and there are problems with these. I'll go into that. It's very expensive. It's risky to women, and there are long-term effects, and we've said that it's totally incompatible with Catholic teaching. So in the selection process, when embryos are selected to be implanted, sometimes too many of them are fertilized and they're discarded, or they're frozen, and many of them don't survive the freezing. And in fact, there are actually millions of embryos around the world in suspended animation being frozen, and without any clear plan of what's going to happen to them. Then one of the most terrible things is we see in the bottom right multifetal reduction. This is one of the worst technologies, and there have been some infamous articles that have come out of this in the New York Times and other prominent publications recently. And I recently had an indirect experience of this this was horrible. And in the past, if a woman naturally conceived triplets, even though there are some more risks to this, she would carry them to term, or twins. This was considered as not exactly a normal thing, but a common thing that would happen with natural conception, and again, more risk to the mother and the baby, but it would be considered normal for a woman to stay pregnant with twins. Now with IVF and some of these technologies and transferring multiple embryos, sometimes people would come up with quadruplets, quintuplets, or more surviving pregnancies than the women wanted. And so what's done is at about 14 or 15 weeks gestation, an OBGYN physician, often a perinatologist or high-risk pregnancy doctor, will, under ultrasound, inject directly into one of the baby's hearts potassium chloride and kill them. And over time in the pregnancy, the babies that are killed dissolve. And sometimes a woman loses a pregnancy, but slightly more times the resulting pregnancy will go on. And what's become more common and what's horrified people is elective reduction of twins now. This has become more common when a woman will naturally conceive triplets and twins. It's become common to undergo fetal reduction just kind of out of choice because a woman only wants a singleton baby or a couple only wants that. I recently, I had a fertility patient, and she didn't get pregnant right away. I think she had polycystic ovarian syndrome. And after about 2 or 3 months, unbeknownst to me, she went elsewhere and had IVF. And she was only 30 years old, and it's not very hard, actually, for this type of patient to get pregnant, either through technology or IVF. And so she conceived right away, and I think they tried 2 cycles on her. The first cycle, they implanted a single embryo. I applaud them for that. There's less loss of life when they do that. And then in the second cycle, they implanted 2 embryos, and one of them split in 2, and she ended up with triplets. And as happens often with multiple pregnancies, when people can get hyperemesis, where they have severe nausea and vomiting, and this woman was just vomiting her guts out day and night. And because of the triplets and because of the hyperemesis, she went to high-risk pregnancy doctor, referred to UC San Francisco, which was one of the places where they developed this technology, and they did a fetal reduction from triplets to a singleton. And then she came back to see me after all of this. And so I saw her when she was about 15 weeks pregnant, and I had never seen this before, but I was just blown away when I did an ultrasound on her, and this had just happened. She had just undergone this killing of her 2 babies, and so I saw 2 big babies, 2 large dead fetuses about this big, like little rabbits, floating around in her womb, and then underneath the live one. And it was just shocking to me. I mean, I have been an OBGYN now for a long time, and I don't get shocked easily, but it was totally shocking to me to see these 2 dead babies floating around in this mother, and then the one that was remaining alive. And we have no idea what kind of psychological and other problems that are, or immunological problems to boot, come up many years from now, but this has unfortunately become more common even with natural twins and triplets. So I think this is kind of the worst kind of loss of human life from IVF, but there are plenty of other mechanisms where this happens. And then the other way life is lost with IVF is in normal pregnancy, there's a single egg, a single ovum, and people naturally get pregnant from this. Somehow the statistics aren't quite like this with IVF, so there are more embryos planted than are expected to survive. So we would call that planned attrition. You want to come out with a singleton, you implant 2 or even 3 if the woman is older. Excuse me, I'm going in the wrong direction. So another big bummer with IVF is the high failure rate, and people don't realize that a very large of these very, very expensive cycles do not produce live birth, and there are many, many ways where they don't work. And in fact, 90% of attempts fail for women over 40, and so even if a woman succeeds with maybe what you might call a chemical pregnancy, there's a high rate of miscarriages, tubal pregnancy, and stillbirths. And here's a diagram. It's a little bit older study, and so the numbers are a little bit better now than they were 10 years ago. But if the cycles are begun, sometimes there are too many eggs or not enough eggs, so they're abandoned, and so there are fewer retrievals than cycles started, and then the embryos aren't good, so not very many get transferred, and then the embryos don't take, so there are fewer pregnancies, and then again with this high stillbirth and miscarriage, there's a lot of loss in there. And in fact, there was a very interesting article that was in the Wall Street Journal about one woman's personal experience with failing IVF over a year and what a devastating experience this was for her. And she kept on working. A lot of women don't work during this kind of therapy because they feel so awful with all the injectable medications that she would furtively sneak into her car and shoot herself up with the medications that are used. And people mortgage their houses, borrow enormous amounts of money, and lots of times it doesn't work. So another bad thing with IVF is multiple pregnancy. And I think superficially people might think, oh, how fun to have twins, instant family, but there really are a lot of problems with multiple pregnancies. And let me just go over some of them. Prematurity. With triplets, the average time they're born is 33 weeks and 85% survive. With quadruplets, if a woman chooses not to have her pregnancy reduced, at 29 weeks, only 70% survive. And they have quite a bit higher chance of medical and physical disabilities such as blindness, cerebral palsy, 5% in twins, 10% in triplets, 50% in higher order multiples. And then there are lots of maternal risks with multiple births, diabetes, hemorrhage, family risks such as social isolation and divorce. So it's quite a stress, and the risks go on. Multiple birth babies are 7 times more likely to die in the first year of life. And we see with the outcome of treatment, and this is, I think, the most recent numbers we have, the percentage of live birth with twins is very, very large. 33% with younger women and 23% with women in the 30s. So this has a devastating effect on public health because so many women are doing this type of therapy, and these babies are ending up in the nursery, and guess what? We're all paying for it. Maybe a couple will pay for their IVF, but this resulting thing, these resulting numbers here of the multiple births, you could even consider a public health crisis. And then it really, really costs a lot too. Now, the multiple births cost enormous amount. I mean, if a baby is in an ICU, $1 million bill isn't that unusual, and every month in there is $150,000 to $200,000. And then there are just enormous costs of medication, office visits, ICSI, and that kind of thing. And of course, one of the things with IVF is that it allows third-party conceptions and donor eggs. And these are very expensive because people buy eggs. And we don't know the long-term side effects. And also, IVF allows crazy things such as the optimum and people to do whatever they want. And some of the newer data about IVF has shown in Europe that there are more deaths from IVF than there are from abortion in Europe. And it isn't only the mothers that are getting pregnant from the IVF, it's donor women that have a serious problem, and they're sort of lulled into, for money, and even large amounts of money, donating their eggs. And there was actually a really excellent film that you could get called Exploitation about even some donor women that have died and had serious side effects from this. So in Catholic teaching, we don't like IVF because it separates procreation from the marital act. It allows third parties, interferes with the marriage relationship. It allows selling of ova and sperm. And actually, we have kind of a real free-for-all in the U.S. People come from all over the world because we have unregulated IVF, and anybody can basically buy themselves an egg or a sperm or rent a donor womb and do whatever they want. So people come here from all over the world for that. And so to be compatible with Catholic teaching, we believe that the spouses must totally give of themselves to one another, and that a pregnancy should be through the union of egg and sperm from a husband and wife, and never a third party, and through normal intercourse. And so nanotechnology, natural procreative technology, avoids all of these problems and is essentially diagnosing the problems with men and women and fixing them. So the step one is the fertility care charting, and through this we can actually see patterns of abnormalities. Then we do a detailed hormonal evaluation. There can be problems such as thyroid. The most common one is polycystic ovarian syndrome. Then we do an ultrasound evaluation and seminal fluid analysis, and there's an ethical way to do this. And then finally, surgery is a key part of this. And especially as women get into the 30s, endometriosis is an extremely common cause of infertility, and so being an excellent endometriosis surgeon or having access to one is a very, very important part of nanotechnology. Also, nutrition, stress reduction, lifestyle improvement can be very important. And so the most important type of observation for pinpointing the time of ovulation is the vulvar mucus observations. Another thing that is sometimes used is the clear blue fertility monitor that gives you a little bit of advance warning. And so with people of normal fertility, virtually 100% of them, if they do this type of charting, will get pregnant within 6 months. And even with this kind of charting, knowing the time of fertility, 36% will be pregnant within 6 to 12 months. And actually, I just got back from my second trip in Nigeria, and I was going there to help with maternal mortality, but there was tremendous interest in infertility therapies. So actually, people were snuck into prenatal clinics. I thought someone would be pregnant, and I would say, "Oh, when was your last period?" And they said, "I'm here for infertility. I can't get pregnant." And so we would go over, basically learning fertility-focused intercourse in that half hour. And when I came back 6 months later, there were several of them who had gotten pregnant from just learning about that from the first time around. So that was very gratifying. But we see with people with fertility problems, 36% will become pregnant in 6 to 12 months, just basically from that. And this is what the fertility care chart looks like with the bleeding patterns, the green being the dry part of the cycle, the white being the mucus, and the various patterns actually are significant and correlate with different abnormalities. And I just want to distinguish between the kind of hormonal therapies we use with NAPRO technology. We try to mimic or create a perfect natural cycle. And what's used in IVF with fertility drugs, and often at much higher doses and different expensive injectable drugs as opposed to simpler drugs, usually is hyperstimulation, where drugs are used to create a maximum amount of eggs, and then the eggs are harvested, and then some of them are frozen or used for future use, or all fertilized at the time to create embryos that are frozen. And so it's a really totally different approach to hormonal therapy that we use. And then we track the follicle, the follicle where the egg develops, and study that. And then again, I mentioned that surgery can be, if a woman doesn't get pregnant through simpler means, or if she's had infertility for a long time, laparoscopy and then further surgery to take care of endometriosis, tubal adhesions, and that kind of thing can be critical. So how well does NAPRO technology work? It can work really well. These are statistics from Dr. Hilter's own practice in his textbook. And we see that the easiest thing to fix is anovulation, and also endometriosis and other things with a total program of natural procreative technology can work really well. Now this is over perhaps the course of a year, 6 months to a year, so it's a little bit different way of tracking people rather than per IVF cycle. And another very good study on NAPRO technology was done in Galway, Ireland. And there's a clinic there for quite a few women, where quite a few women have been treated, and quite a number of these women had failed IVF and succeeded with NAPRO technology. And so we see, this was kind of an older population. The average female age was 35. Average time trying to conceive was 5.6 years. And so they did quite well. There's different ways of calculating the success of fertility therapies. One is the crude life birth rate, and the other is an adjusted life birth rate, where you carry, there are cycles that drop out, and you adjust for the number of dropouts. And there's actually a pretty high life birth rate, especially compared to IVF. And so this is just Dr. Boyle in Ireland in his clinic. And if we compare cohorts, meaning that are fertility programs, on the left we have a Netherlands IVF program, and then on the right we have Dr. Boyle's program from Ireland, and the populations are a little bit different. The women were a little bit younger in the Netherlands population, and they had never had IVF, whereas some in Ireland had failed IVF, and they had actually fairly comparable successes with fertility. And this is without any of the moral or ethical problems that are involved with IVF. And also, the cost of natural procreative technology is much more reasonable than IVF. And take a look at the twins. Rather than 33%, we get with natural technology 4.5%. So this is a lot healthier. And this is just a picture of infertility in Nigeria, and we actually had dozens of people lined up when they announced in church on a recent visit that we would want to see people for that. And on the right is a picture of my youngest couple that I've ever had, who the girl is 14 years old. And so we told her we didn't think anything was really the matter, and probably it would be all fine when she was 17, and if she still had a problem, to come back. But at any rate, the key outcome is a healthy singleton birth conceived of through ethical means.
Oh, that's